afternoon, everyone. Today, the case conference is of patient X, who is 26-year-old male, single, Hindu, from a nuclear family, educated to class 10, residing in Tiri, Garhwal, Uttarakhand, belonging to low middle class socio-economic status as per Kukushwami scale, admitted to the hospital on 16th of May 2022. Identification mark, a tattoo of his name on the flexor respect of the right forearm, 4 centimeter from the elbow bone. The informants are father, Mr. Mahipal Singh, who is a 52-year-old male, not formally educated, the driver by occupation, not living with the patient throughout the illness. Anand, 32-year-old male, brother-in-law, educated to class 12, chef by occupation, lived with the patient during this episode. Beena Devi, not formally educated mother, homemaker, lived with the patient throughout the illness. History given is clear, consistent, coherent, given in a chronological order, corroborative among all the informants. History is reliable but inadequate. The chief complaints are irritable mood for past 10 days, increase for past 2 days, restlessness for past 10 days, tall claims for past 10 days, increase for past 5 days, and decreased need for sleep for past 10 days, with physically and verbally abusive behavior for past 2 days. Complaints are acute in onset, episodic in course, and deteriorating in progression. Precipitating and perpetuating factors could not be assessed. Patient was apparently well 10 days back when he was carrying out his normal living activities. He would talk to his mother while in Dehradun and would ask her about her health and would be concerned for his family members. He would be understanding that and would not demand anything from his brother-in-law with whom he would stay in Dehradun. He would be less interactive with people and would stay alone most of the time of the day. While going to work in the restaurant, his brother-in-law noticed that he was irritable towards him and other co-workers, which was unlike him. When he asked to make specific amount of rotis, he would continue making rotis according to him and would end up making 20, 30 of them. Initially, when scolded by his brother-in-law, he would stay silent but not apologize for the reckless behavior. But within 2 to 3 days, he would counter him by saying, "ऐसी ही बनती है, मैं अपने हिसाब से ही बनाऊंगा," on which his brother-in-law would not argue with him. As per informant, he would be seen continuously shifting things from one place to another, even though they would be at the right place. When asked about why is he doing, he would get irritable and would say, "गंदगी रखते हैं सब, कोई ध्यान नहीं रखता यहाँ पे." It would be difficult for him to sit at one place at work and would be seen pacing around and doing work more than usual. At one instance, 4 to 5 days back, he asked for mobile of his brother-in-law for playing games, and when he asked him to wait for a while or play his phone, he would he got irritable and started shouting at him. He would not usually do. He said, "भाग जाऊंगा मैं यहाँ से नहीं दिया तो." He would often ask for food at the workplace. He would daily ask for rupees 500 from his brother-in-law and would spend them unnecessarily on food and other. When his brother-in-law would refuse him to give money daily, he would take money by himself from his brother-in-law's wallet and would himself report to his brother-in-law that he took the money when his brother-in-law would be seen searching for his money. When his brother-in-law tried to explain him about their financial constraints, he would say, "बहुत पैसा है मेरे पास, मुझसे ले लेना जितना भी चाहिए." He would repeatedly ask him to get his business started by investing in a restaurant. He would be restless most of the time and would rush to the washroom 3 to 4 times in a day to brush his teeth. He would have difficulty in the onset of sleep and would wake up after 20-30 minutes after going to sleep and would be seen rushing to washroom for bathing in the middle of the night. When asked by his brother-in-law not to bath at late at night, he would again go back to bed, but would be seen listening to music for 2 to 3 hours. He would then bathe at 3 to 4 in the morning and would go out of the house without informing anyone. On being called, he would say that he wanted to visit temple and would return back home after 2 to 3 hours and would be energetic throughout the day. 2 days back, he engaged in a verbal argument with a customer and also asked all his co-workers to leave the place when they tried to console him. After which his brother-in-law decided not to call him at workplace and sent him back to his father, wherein he would be irritable towards him and would refuse whatever he would ask him to do. One day back, his father saw him selling an old bicycle of his landlord. When his father asked him, he said he sold it as it was a garbage. On being scolded by his father, he got violent and punched his father on the face 2 to 3 times. Citing which, patient was brought to the outpatient department for admission and management. There is no history of over-familiarity, no history of sustained over-cheerfulness, over-religiosity. There is no history of hearing voices not heard by others, seeing things not seen, others cannot see, thoughts being introduced into or taken away from mind by external agency against will, feelings, drives, or sensations under the influence of external agency. There is no history of low mood, decreased interest in previously pleasurable activities, crying spells, pessimistic thoughts about future, ideas of guilt. There is no history of head injury, loss of consciousness, abnormal body movements associated with incontinence, a rolling of eyeballs, a tongue bite, blurring of vision, memory impairment spells. So, treatment history, patient was on 16. He was admitted on 16th of February. 2 days back prior to it. Treatment history, patient was given 3 milligrams of risperidone in 2021, 5 milligrams of trifluperazine and 2 milligrams of triethylphenidate in 2021. But the compliance was very poor and patient did not take medications for more than 10 to 15 days. With no significant improvement. Past history, there is no significant past medical and surgical history. Family history, he is a third in order out of 3 siblings. For 10 days. So last episode. There are 5 episodes. First episode was present, current episode. 10 days. So the first episode was in 2018, wherein patient returned back from Mumbai when he was unemployed, and some co-workers blackmailed him about a girl. So he came back from Mumbai, and there was complaints of overtalkativeness, tall dreams, decreased need for sleep, for which patient did not take any treatment and was asymptomatic after 10 to 15 days. But they were full integrated recovery. In 2020 of April, the patient again had the episode of overtalkativeness. नहीं सुनिए ये in 2020 so in 2020 patient had similar episodes, 2 episodes in 1 year, for which patient seek treatment in Dehradun and was prescribed risperidone and triethylphenidate, trifluperazine, but patient was not compliant for medications and he would not eat medications. Then again in 2021, he had 2 episodes wherein he again was started on treatment but was not compliant and he threw all the medications. The current episode is in May, lasting for 10 days. 6 episode. Duration of the episode 2 months, 1.5 to 2. पहला वाला मेडिकेशन नहीं लेते अभी नहीं लेते नहीं वो उसने उसके फादर ने बताया कि उन्हें सारी फेक दी थी ये risperidone and triethylphenidate बट उसने खाई नहीं नहीं खाई थी वो लेके चला गया था मुंबई एंड वहां पे उसने फेंक दी थी जैसा उन्होंने बताया no episode where he was compliant.
And every time there was no cheerfulness. There was
Over-talkativeness was present, but over-cheerfulness and over-familiarity was tall claims. But over cheerfulness was never, over familiarity was never reported in any of it.
So he was more withdrawn. At that time, more withdrawn. Rather than the usual time.
Not withdrawn, so but he was irritable. Over familiarity. Overspending. हाँ जी.
ये अगर होगा तो ऊपर familiarity हम लोग मान ही सकते हैं होगा.
बट ओवर फेमिलियरिटी सर उनके अटेंडेंट्स ने बताया कि लोगों से बात नहीं करता था.
कौन सी चीज़?
टॉल क्लेम्स की पैसा बहुत है एंड मैं शिवाजी छत्रपति में
हाँ. तो ये information किससे मिला?
ये उनके फादर से मदर से भी. फादर से इतनी हिस्ट्री रिलायबल नहीं दे रहे थे, मदर से भी. और उनके ब्रदर इन लॉ जो भी सब.
तो मैं छत्रपति शिवाजी हूँ और मैं आपको बैठा रहता हूँ. मैं ऊपर familiarity दिखाने के लिए मैं बोल रहा हूँ कि क्या मतलब क्या हो सकता है कि हमने हिस्ट्री मिस कर दिया है. कि
सब देख के भी मतलब ही वाज
आपने
नेवर
देखा कि क्या तो मैं उस लेवल का हूँ, मैं क्या करूँ? अब हो सकता है I think that my figure is definitely on this level.
आज उनकी मैंने मम्मी से बात की 2 months.
कोई substance नहीं लेता था.
ओकेजनल इनटेक ऑफ अल्कोहल.
Cannabis बिल्कुल नहीं लेता था.
Why they looking for treatment every time, but every time we did not take medication.
So first time they did not take him on treatment. They gone for faith healing, but he responded on faith healing. हर बार पीके गुप्ता सर से ट्रीटमेंट कराते थे, लेकिन वो ट्रीटमेंट नहीं कंप्लाइंट मिला था. सर 2021 में तो इसने नहीं लिया. 2022 में 2020 में इसने लिया था थोड़े टाइम के लिए, बट 10-15 डेज.
रिस्पॉन्ड किया था.
But every time that's baseline. Every time still does doctors in hospitals. Even though he has been improved without any treatment every time. इसका वो एडमिशन के लिए मान के ये निकाल के तो वैसे हो जाता है. हाँ ये वो मेरे ही होती थी क्या? मेरे ही होती थी.
faith healing.
मेरी दवा फिर देखे तो जल्दी लगा. That means 10 days एडमिशन के लिए मान के कहाँ से?
सटीरी करवा.
उस बार क्यों बुलाया था?
तो हर बार उसके फादर को पता लग जाता है कि अभी ट्रीटमेंट की जरूरत है, तो ही ब्रॉट हिम अर्ली.
सर बात आता है इसके बाद सर घर वालों बाहर
बाहर रहता है सर. हर बार बॉम्बे या बैंगलोर से ही वो शेयरिंग ले रहा है.
सो हिस्ट्री है
सर हिस्ट्री रिलायबल एडिक्वेट नहीं. उसके फादर कुछ बता नहीं. सो रिकॉर्ड्स में ट्राइफ्लूपैराजिन, ट्राइक्सिफेनिडल और रिस्पेरिडोन प्लस.
वो ऐसे करते हैं पहले 5 दिन देख लेते हैं फिर उसके लिए लाइट
सर वैसे फिर
ऐसे क्या अभी क्या एक पेशेंट किसी को डॉक्यूमेंट करना चाहिए.
significant here. Episodes of trance and possession in mother, father, and sisters, and culturally they were. Patient has cordial relationship with parents and siblings. Economic head of the family is father. Emotional head of the family is mother. Patient is closest to his mother. Family is supportive towards the patient and supportive towards his illness. And he understands the importance of regular follow-up and compliance. Personal history of occasional intake of alcohol. For birth history, there is full-term normal vaginal delivery at Gangaram Hospital, Delhi, with no history of admission in ICU, no history of fever, no history of all developmental milestones achieved as per age, no history of antepartum, intrapartum, postpartum complications, uh, complete immunization as per schedule, and exclusively breastfed for 6 months and thereafter. Childhood history, no history of hyperactivity, inattention, impulsivity, repeated bullying, disobedience, bedwetting, and he would share his toys with other children. Scholastic history, patient started schooling at the age of 5 years of age. He was an average student until 9th class and failed class 10 two times, after which he left studies and started working as a chef. No history of change of school since beginning. He was shy and did not take part in extracurricular activities, had cordial relationship with peers. Sexual history, attained puberty at 14 years of age and with start of facial hair and pubic hair. History of nocturnal emissions for past 2 months and no history of sexual contact. He failed 10th class. So he left study.
It's the norm in their family that they don't study much.
They
Do they
studied.
have higher people
But
who are
he,
studying?
but he wanted to earn money and he left studies to work as a chef.
Academics के अलावा बाकी चीजों में कैसा था? बाकी intellectual में
बाकी इंटेलेक्चुअल में सर ऐसी हिस्ट्री उन्होंने नहीं बताई. He would conduct. He went to Mumbai for 2 years. He went to Bangalore for 1 year. He lived there. Intellectually मुझे ऐसे कोई believe नहीं.
दोस्तों के साथ घूमने वगैरह
नहीं. He was shy.
मुंबई में रहता है
हाँ.
तो होता है वीकेंड में चलो थोड़ा सा चल ले सब दोस्तों के साथ मुंबई में रहता हूँ my language was different तो मतलब ऐसे काम मान लो वीकेंड में चला गया दोस्तों के साथ दोस्त तो जाते हैं मुंबई से
उसके दोस्त ज्यादा थे नहीं. Of personality, patient is ambitious and wants to help his parents financially, working as a chef, good social interpersonal relationship with family and friends, hesitant in making new friends, does not have any long-term friends, responsible towards work and family, would make decisions after consulting his father. Intellectual, enjoyed listening to music and interacting with family members. Mood is stable, could express his feelings of anger or frustration. Character, shy at school and reserved nature, religious by nature, abide by the law and respect the social norms. Habits had a regular sleep-wake cycle, rhythmic goal and bladder habits. So on general physical examination, he is the ectomorphic bit male with weight 57 kg, height 181 centimeters, and BMI of 17.4 kg per meter square. 17.4. On entry, the ectomorphic bit male entered the room unaided, accompanied her father, with bilateral wide arms and erect posture, sat on the chair provided, and greeted the interviewer wearing a t-shirt and pajamas. Nails are cut, hair groomed, clothes appear inclined, adequate grooming and hygiene. Appears as per gestated age, initiated but not maintaining eye contact. Appears to be in touch with the surroundings. Attitude was cooperative, heart was established, psychomotor activity was increased, speech was normal with increased volubility, non-goal directed, and when asked mood कैसा है, he said बहुत अच्छा है. Affect was euphoric with normal range reactivity, congruent and appropriate as. So this is the NSC on 16th when he was admitted. Affect was euphoric, normal range and reactivity, congruent and appropriate. Congruent, appropriate and communicative. उस टाइम
लेकिन उसको कभी भी ओवर चेयर में सुखाना इस बार आ गया
so euphoric he was when he was interviewed he was cheerful, but the rest of the time in the ward he would sit alone and he was not interactive.
मुश्किल के साथ लोग होते हैं
That is the important personality is important.
उसके हिसाब से बोल सकते हैं
हाँ मैम ने asked क्या आप में कोई खास बात या शक्ति है, he said हाँ छत्रपति शिवाजी की ताकत है मुझ में. when asked दिखाओ क्या ताकत है, he said नहीं अभी नहीं दिखा सकता, हाथ बंधे हैं मेरे. when asked impression, grandiosity, ideas.
क्या आपको मीटिंग याद नहीं है क्या? मतलब ये जो सारी याद बता दिया था हमने कैसे कैसे नहीं
Euphoric, elate, exalted, morbid, elated, elated, exalted.
अगर तुम ऐसे तो एग्जॉल्टेड भी लग रहा है वो भी था उसका
but exalted तो नहीं है.
हाँ फिर तो तुम उसमें टोन डाउन कर कुछ किया तो मतलब इवन तुम भी व्हाटएवर यू से विल बिलीव यू करते हो कुड बी So what she said is that academically he was not a good student.
He was not a good student, but Emma mentally.
बाकी सब कुछ से करना किया तो मैं सोचता हूँ से वो फ्रेंड्स के साथ भी जाते हैं चलो वो बड़ा अच्छा होता है बॉर्डर
So on 16th, when asked कि the delusion of grandiosity was present and ideas of reference was present, that he would go around his father to say कि क्या बात कर रहे थे मेरे को. क्या आप में कोई खास बात या शक्ति है? हाँ छत्रपति शिवाजी की ताकत है मुझ में. when asked दिखाओ क्या ताकत है, he said नहीं अभी नहीं दिखा सकता, हाथ बंधे हैं मेरे. जब देश के शत्रु अटैक करेंगे तब दिखाऊंगा. तलवारबाजी आती है आपको? so he said 5 दिन 2 मैं सीख लूंगा, फुर्ती बहुत है मुझको. When he was asked to write about his village, he wrote, मैं अपने गांव में सड़क बनवाऊंगा और पेड़ लगाना चाहता हूँ, माँ के लिए चना और चावल उगाना चाहता हूँ.
Expensive ideas.
Expensive ideas.
हाँ, challenge पूरा
सारे factors complete करो।
हाँ, वही।
ये भी next time तो ये choose करके करवा दोगे तो next time तुम्हें ब्रेक मतलब आप तो अंदर है ज़्यादा ये दिमाग नहीं है कोई चला सकते हैं या तो बाहर वो होती है लेकिन next question आ रहा है
You can ask him how he is successful. How? You will answer how. बताएगा ना तो क्या बताएगा कैसे वो successful बना या फिर वही में कह जाएगा इसमें.
Shape. So on current MSc, there was so his attention was arousable but not sustained. He was unable to do serial subtractions of 40 minus 3 and 100 minus 7. Concentration, he was not able to correctly tell the months in a year and backwards and days in a week backwards. He was oriented to time-based person. He was not able to do simple verbal calculations. General fund of information was adequate. He was able to tell the Prime Minister of India and about the pandemic. So memory, recent, remote, and immediate was intact. मूड अच्छा है, अफेक्ट यूथ एंड करंट एमएससी मूड अच्छा है, अफेक्ट यूथ एंड विद नॉर्मल रेंज इन रिएक्टिविटी, कॉन्ग्रुएंट एंड एप्रोप्रिएट, कम्युनिकेबल, abstract ability, patient was could answer proverbs, only 2 proverbs when asked 3, पेट में चूहे दौड़ना and 9 दो 11 होना. Similarity, he could not tell similarity between apple and banana, table and chair. Thought में stream was normal form, no formal thought disorder was present, possession was self. On content when asked क्या आप में कोई खास बात या ताकत या शक्ति आ गई है, तो कहता नहीं, मुझ में क्या शक्ति होगी, मैं बस नौकरी करके पैसा कमाना चाहता हूँ. क्या आपको लगता है कोई जानबूझकर आपको नुकसान पहुंचाना चाहता है या बात कर रहा है, नहीं, मुझे क्यों कोई नुकसान पहुंचाएगा जब मैंने किसी का कोई नुकसान नहीं किया. So content में there is could not found religiosity or referential ideas. The judgment is his, personal and social was intact. Insight was great too. He knew that he had some changes in the behavior, but was not denying any illness that he had.
Racing thoughts कभी नहीं हुए.
सब वो कह रहा है कि मुझे तेजी थी उस टाइम, बहुत गुस्सा
गुस्सा
रेसिंग
प्रैक्टिस जो पे तो मैंने बहुत मेमोराइज में
वही सिंपल कैलकुलेशन तब तो हम लोग ना इजी है लर्नर तो ले
प्रैक्टिस तो मेरे प्रॉब्लम कोई बता रहा है मतलब इंडियन नहीं है नॉन इंडियन है वो बता रहे हैं
हां डिफेंस है सबसे ज्यादा रेटिंग जो है इंटरनेट पे
ट्विटर फॉलोअर्स पता कितने हैं
विराट कोहली को कुछ भी नहीं क्या ये मतलब फिर ऐसा लगता है ना कि जैसे मैथमेटिक्स में कोई प्रॉब्लम है तो हो सकता है कि तुम्हें वो वहां एलडी है मैथमेटिकल एक्सप्रेशन के में आता है हो भी सकता है बिल्कुल वो तो सर्वर
इज गुड पेज ओके राइट से जो तुम्हारा ये क्वेश्चन है एनालिसिस एंड नॉलेज बट इफ यू फील दैट इट इज somewhere affected then you have to ask more questions in that category only if you feel they are also affected get into simple questions if you feel still they are affected then learn the test there are many questions which have been different books but for say structured evaluation psychosis
is kept on a differential diagnosis of bipolar affective disorder, current episode mania with psychotic symptoms. Six. ICD. Bipolar affective disorder 1.
affective नहीं bipolar disorder affective है word है. Yeah.
bipolar. So on Young Mania rating scale, his score was 19 at the time of admission. Current score is 5.
बहुत अच्छा मिला मतलब वैसा नहीं है।
bipolar disorder और mania में क्या फर्क है? For example, इसके केस में ये पैसे का नहीं है, तो इस तरह bipolar वो तो bipolar